And self-pay / cash, which is my least favorite. With some of these meds, they can be quite expensive, but that is one of the big ones. I wanted to say before we got too far into it is that I have a lot of people that tell me I don't have the money for this medication. If I had more money, I could pay for this. And I will tell you that out of years and years of doing this, I have never once had a patient tell me, cost is no object. I can pay for whatever, no matter what. So we are all in this boat together when it comes to paying for meds. It's a concern, and and that's why you have me here to help. There are other navigators at outside offices as well to help, nurses, etc. The big one, prescription insurance. Most of my patients have Medicare, like Medicare Part D. Part D is, I remember D for drugs. D is the prescription portion of Medicare. I do get a lot of questions. Which one's the best? Humana, Aetna, Cigna, etc. And the answer is, it depends. It depends on what meds you're on. It depends on what other conditions you have. You may be on a super expensive med for congestive heart failure, but your Parkinson's meds may not be that expensive. So the answer for you would be different for the answer for somebody else. Let's see here. So, and I have a resource on a slide from a couple from here that will show you who you could talk to about choosing the best Medicare plan. I have a couple of my favorite little resources. I think everyone has probably heard those dreaded words, donut hole. I hear that one quite a bit. I've got voicemails at 8 p.m. with those two words in them. Please help after those. So I think everyone will be excited to hear that coming up in 2025, there's going to be a $2,000 cap on your out-of-pocket for drugs, for medications. Now, $2,000 is not a small amount of money, but it's better than I think it was $8,900 or $9,000 that it was last year, the year before, and I've heard even more than that. But this is the good news coming up for that. Let's see here. So you come to see your provider and say, I have this great drug for you. It may be a little expensive, but I have this great drug. I love that. But one of the questions after the appointment is, or even during the appointment, will my insurance cover this med? And that's where I come in. Every insurance company, and I don't want to get in the weeds about insurance terms because it's not super exciting, but it's important, is every insurance company has what's called a formulary. Humana has a list of drugs. They're like, we'll cover these meds for Parkinson's. And we'll cover these meds, but you're going to pay more. And those are called tiers. So every company has a slightly different formulary. So when, like Dr. Cloud is one of the attendings at BCU in the Parkinson's clinic, she's the director, don't tell her that I say one of the attendings, she'll beat me, but she's the director. And if she prescribes something, you say, and she'll say, is that on formulary? And she can see in the system. If it is on formulary, great, we'll talk about copays. If it's not on formulary, then we start talking about fun things called like prior authorizations. And again, we won't get too far down there, but one of the first questions, is this medication covered by my insurance? As you can see at the bottom, a drug may be covered by your insurance, but that copay, I have copays of $2,000 to $3,000 a month, sometimes even more than that. So there's coverage and there's copays. And what one person can afford, another person may not be able to afford. And again, it depends on what else you're taking. A Parkinson's med for $1,000, and then you only have $10 for the rest of your meds. That doesn't work. So we're going to get to the copay side of things, but I just wanted to put up there that if a medication is not covered by your insurance, our office can do, or any office can do, a prior authorization. I talk to the insurance company, I bat my eyelashes, and I say, this is why we want this drug specifically. They might say, well, I don't want Gary to take this med because he has a history of this, and this med is completely contraindicated, I don't want him to have anything to do with it. And they may say, sure, that works, like, we'll pay for it. I don't normally get told no. It happens rarely, but we can pretty much argue a case for just about every drug. Again, we come back down to copay versus coverage. Is insurance company can approve the med and say, sure, we'll cover it. That'll be a $2,000 copay. So great, I love that you covered it, but that's still a lot of money. So here is how, sorry. I love Medicare, but it can be very complicated and it sometimes can be a dry topic. So I'm trying to make it as exciting as possible. There is a program called the Extra Help Program through Medicare. There is an income cap. It's on the next slide. You can apply for it and it will cover your Part D premium costs. And as you can see, $4 for generic drugs and $11 for brand name drugs. But there is a pretty strict income cap on the Extra Help Program, as you can see. Income limit, what you bring in, and the resource limit includes your assets. It's another word for assets. Not a whole lot of people qualify for Extra Help, but people that do, this is a lifesaver. So keep this in your back pocket if you do qualify. Here we go. One of my favorite resources in Virginia, BiPAP, the Insurance Counseling and Assistance Program. It's 100% free. People volunteer their time and they answer questions about what Medicare program is best for me, what is an Advantage plan versus a traditional Medicare. I love the long-term care insurance, the Commonwealth Coordinated Care Plus, Medicaid. You can pick up the phone, you can call them and you can say, I have no idea what direction to go in. Can you please help me? And they are kind, they are patient, and they are based in Virginia. I just put the toll-free number. But great resource, and I do have copies of this presentation up front, and I can email it to whomever if you would like to take this for the phone numbers and the websites, so you don't have to jot everything down. But this is a great resource. And at the top there, Medicare can be complicated. I mean, this is what I do, 50, 60 hours a week and have for years. And I still have questions about, wait, what? When it comes to Medicare, I think that I don't know anybody that knows all the ins and outs of Medicare 100%. And just when we feel like we're getting a grasp, the next year comes up and they're changing, sometimes for the better. So, but this is a great resource. Another part of paying for medications, drug manufacturers. I know sometimes I'll give you some insight. Nurses will hear drug manufacturers and think, no, actually can be a great resource. Amneal has a program for Rytari, which is an extended release carbidopa levodopa. They have one for Ongentys, but I put this up as an example. You do have to meet some income requirements. There is a cap. But if you're eligible, you get free meds for a year. That's huge. Rytary can be pretty expensive. So I wanted to give you guys an idea as to, like, that is just a little portion of the application. So drug manufacturers, you can normally find it online, or again, ask the nurse. But finding the drug manufacturer's website, and there is always resources, savings and support, or for patients. They all have a 1-800 number, and I have this on one of the slides, but one of the most important takeaways I hope you guys get is, don't be afraid to pick up the phone, call that 1-800 number and say, I need this medication. This copay is not something I can manage. What can you do to help me? And you'd be surprised. A lot of companies have resources and you just have to call and ask. So these 1-800 numbers, you may call them care coordinators, things like that. There's some resources out there. So I wanted to put up, so this is one example of the drug manufacturer. Love this one, the Assistance Fund, or TAF. They're wonderful. I think the cap is $3,000 a year. They're currently on a wait list. But $3,000, one of my patients got this, and I put in the application, providers can do it, and you guys can do it, but I went ahead and did it for my patient, and immediately received approval for $3,000. I called the pharmacy and gave them the information, and they ran it through, and the patient had the med the same day. So it is a wonderful thing, and I again, you're like, man, get to the end of your slides, but at the end of my slides, I put that there is nothing wrong with putting yourself on a waiting list. Funds become available all of the time, and if you're on that waiting list, they will call you, and it's in order. It's not going to be the person that gets in right at the last minute. The person who's been on the waiting list for 6 months is going to be ahead. So if you foresee next year maybe trying a different med or needing extra funds, go ahead and get on the waiting list. The worst that could happen is that funds don't become available and you don't get a call, but the best that can happen is you do get a call and they say you're in. So there is a waiting list, and that is for the Assistance Fund. Another one of my favorites is the Patient Advocate Foundation, or they have a sub program called the Copay Relief. And there are income requirements, as you can see, the federal poverty guidelines. This is the Health Equity Fund. It's specifically for people that live in certain area codes. I have a lot of patients in like southwestern Virginia that some of the counties there that get this. It's $2,500. You can click on the "Is my zip code eligible?" It puts it in, it'll say yay or nay. You put in your application, and again, that is also almost the same day thing. So that's the Health Equity Fund. That one is open now. Here is the Parkinson's Disease Fund. This one, it says needs are identified. So they do have a waiting list going, but they haven't dispersed funds yet. But that's another one. That one is also income-based. So for these prescription assistance programs, a lot of them are based on income. Everyone is different. Some of them use the federal poverty guidelines. Some of them have a number that they've established on their own. Something that sometimes gets some of my patients is they will ask questions. What was your adjusted gross income? They're going to ask questions, usually based on your last taxable year. So, and they may ask for a social security number. If you don't want to do that online or over the phone, there are paper applications, but they are going to need some personal information. I always tell people have your tax return because they're gonna wanna know, like, what is your household, the income and the number of dependents, et cetera. They don't get too far into it, but they do want that information. Let's see, and there I put it, if it's on a waiting list, not a bad idea to get on that waiting list. I think most programs kind of renew at the end of the year. So if you do get the funding about a month or two before the end of the year, they will let you know and say it's time to reapply. So the funds are there and normally renewable. Let's see. There are some nonprofit, obviously. Over Parkinson's, here's one. Here is another nonprofit organization, the Melvin Weinstein. He had Parkinson's, and his daughter and granddaughter came together and said, you know, we were blessed with good financial luck, and we would like to give back. So this is the application, and there is some personal information, you know, explanation of income. How did you learn? Like, how did you learn about us? How can we help? And kind of not why should we help, but explain to us why you need this help. But I love this one. It's a 2-page application. They do require, I believe, a tax return to go along with it. And the provider's office, we do have to fill something out, just kind of confirming the diagnosis. But other than that, this is a wonderful foundation. I think most recently I had a patient who had their use-step walker. Oh, I don't know if I'm supposed to say products, but a walker that is great for patients with Parkinson's, paid for, and I believe it was about $1,000. So that helps. Let's see, copay cards. I love copay cards, but they are often for patients with commercial insurance, which I'm sure you know, it's not a lot of Parkinson's patients. So copay cards are great, but the fine lines usually say not eligible for patients with Medicare. But I could be surprised from time to time. I'm usually not. But this is the Rytari copay card. And some of them are great. You know, $25, some of them are $0. But every time I see a drug rep, they say, is there anything I can help you with? I say, yes, I would love a copay card and more assistance for my Medicare patients. So Rick knows. Rick's one of my buddies back there. Every time he sees me, I say, yep, this is what I need, and they work towards it. But if you see a copay card and someone's like, oh yeah, I got it for $0, just make sure you double check, because a lot of people are not commercially insured Parkinson's. So, okay, so these are my favorite slides. Tips and tricks from me. GoodRx.com, and I guess I should have prefaced this with, I'm not a paid spokesperson for anybody, but when it comes to helping my patients get their meds paid for, I'm going to tell you what I honestly use. GoodRx. It is, so the website opens up and there's a box. You type in the name of your medication and you pick the dosage, and up pops a screen with the cost. I don't know if you can tell, but if you got this med at Walgreens, it would be $320, but if you got it at CVS, it's $120, and that's huge. So if I have a patient who said, I'm on this drug, I can't afford the copay, I'll look it up and I'll say, how attached are you to Walgreens? I can go down the street to CVS. I think it's a good idea. Let's see. The nice thing about GoodRx is pharmacies are very knowledgeable about it. They're used to working with GoodRx. So if you say, could you check the GoodRx price? Bless you. They will look it up and can apply it directly. You don't have to bring a coupon in or anything. If you look up the GoodRx price and it's something that you're interested in, you can this is just an example of one of the coupons, but you can print that, or you can email or text it to yourself. There's a VIN number, there's a member ID, they run it just like insurance, and they put that on file for as long as you have the prescription. Let's see. And it may not help with every medication. I've almost fallen out of my seat a couple times where I've typed in a medication and what popped up had 4 or 5 digits for a monthly payment, which is crazy. But it's a really simple thing to do, to put in the medication and check the cost. So what I love, side note, my ex-husband is the children's librarian here, and it makes me happy to think that that is what's going on with it. And I put, so it may not help with every medication, but if it helps with some or even one, that could be a lot of money. And I put, it's not only for Parkinson's meds. It has blood pressure and I know I keep harping on heart failure, but those are expensive meds as well. So you have to take 5 minutes and type your meds in. You may be surprised. I have, you know, I have great commercial insurance and my copays are normally low, but I was surprised when I look up GoodRx, I check the meds that I take, and one went from like $80 to $3 with GoodRx. So it's worth looking into. So it's one of Nurse Annie's tips and tricks. Love this one. Has anyone ever heard of Mark Cuban? Oh, love it. So I don't know if his pharmacy was called Mark Cuban and they added Cost Plus, but if you hear someone say Mark Cuban, the name of the pharmacy is Cost Plus now. It is a real pharmacy. Prescribers can electronically prescribe or fax prescriptions to it, and they will mail you your prescription. So the medication that we were just talking about, that was, you know, the $282, I don't have a pointer, sorry, but it's up here and it's $17. Same med, same quantity, same everything, $17. And so whenever I have a patient that goes on some of these meds, I try to point out and say, well, let's check this medication. Let's check Cost Plus, let's check GoodRx. Because it could save hundreds, if not thousands of dollars. This is just a smattering of the Parkinson's medications that are covered. And they're not all super inexpensive. I mean, I've got Mirapex there for $80, but you can see, I mean, most of the meds are pretty reasonable. The only thing that catches some people is you do need an email address for Cost Plus. You have to set up an account. The email address, you do have a password, and you do have to put in credit card information. So the only thing I would recommend is if you do sign up for this, is to do it on, say, your computer at home that has the safety features on it. Because I know I get leery of putting in my credit card number. But you set that up, and then when we send the prescription to the pharmacy, they pull up your account, it's run through, it's shipped to you, and it's all taken care of that way. It's kind of one big cycle, but you do have to have that email address and your account set up. And we're able to do that. I know at VCU, and I'm pretty sure any provider, there's always something that's like notes to the pharmacist, you know, please make sure that this is crushed or something like that. And what I do is I put my patient's email address in there as their account, and it's pulled through, and I have not had any issues. So this is an amazing resource. So, you know, and I am here talking about Parkinson's meds, but we all are kind of a big group of things. We're systems and hearts and lungs and kidneys and stuff. So I wanted to put up that on the website, you can actually click on, say, oral health or nausea or something like that, and the list of medications that they will cover is right there. So just it's one of my fun tips and tricks. Okay, so takeaways. There is help out there. I know it seems, I've had patients in tears saying, I can't afford my Parkinson's meds. I'm choosing between my like extended release levodopa at bedtime and food. And that shouldn't happen. And there is help out there. I help, well, let's say, I find help. I find help. The providers find help. The providers will come up and say, I really want this medication for my patient. I don't know if they can afford it. I'd like to help. Could we write an appeal letter, something like that? None of the providers want to prescribe a med that you cannot take. If they are making that decision to pick that medication, it's for a reason. They think that that is the best med for you. And they're on your side. I'm on your side. Drug companies, there are resources out there. There are foundational funds. I mean, sometimes I hear, yeah, the funds are out there, but nobody has applied for them. And that just breaks my heart because I hate to think of pots of money sitting there waiting to be used. Don't be afraid to ask. I do have patients that will say, will call me later on in the evening and say, I was really embarrassed in the appointment. I didn't want to say anything about being able to pay for my medication. And it is something, like I said at the beginning, that affects everybody. I don't have a single patient that's like, no, you charge away. I'll pay for whatever. So asking the prescriber, nurse, you can ask at the pharmacy too, when you go to pick up the medication and they say, that'll be $3,000. Say, well, let's rethink that number. Is there anything that you could do? Are there any funds that you can think of? And most of the time, the pharmacy is really willing to help. Now, less likely 5 p.m. to 7 p.m. on a Tuesday. But sometimes during the day, you can pull somebody aside and say, I would love a little bit of help with this. And PAPS, I love that. And that's the prescription assistance programs. On my handout, there are the 1-800 numbers. Calling and saying, you know, this is what I need. Can you help me make this happen? And if they say, no, I'm sorry that we don't have the funds for you or you're over the income limit, then that was a 4 or 5 minute phone call. But a lot of times they are able to help you. Easy to get discouraged. I remind myself of this too. I spend a lot of time fighting insurance companies as well. Had a few of them hang up on me, but that's okay. If for some reason you have hit a roadblock, every single roadblock, and it seems like nothing else can be done, you can always talk to the provider and say, you know, this isn't going to happen. This med is $12,000 a month, and they'll come to me and I'll say, we really have tried everything. And I won't get into the medicine part of it, but there are normally other medications in the class. So I do have patients that will call me upset, feeling like if they can't get this medication, then there are no other options for them. And I'll call them back a couple of weeks. Well, it's not 2 weeks in between when they call me and when I call them back, but I'll call them and check on them. And they'll say, no, I couldn't get insurance to cover, so I just dropped it. It's like, no, like have an open conversation, like open communication with your provider, and be honest, you know, I can't afford this med, and Most of the time, they're gonna say, all right, well, let's get creative. What else can we do? And they will work with you. I put a couple of, I don't know if anyone's ever seen these two, but there are some meds where only that med does only that thing. But for the most part, there are several drugs in the class. If unable to obtain coverage for a medication, what you may hear your provider say is, okay, like you will need to try this other medication first. Don't be discouraged because sometimes that less expensive medication works and is great. If it doesn't work, then we click that off and we tell the drug company, yeah, we got you. We tried it, it failed. We don't want to use it, and then normally they'll say, okay, all right, you tried the other med, we'll go ahead and cover this. So if you do get an answer back, like, okay, you'll need to try this other one first, don't be disheartened, because sometimes I have used, I had a patient who tried Azilect like 30 years ago and had constipation. And I used that to get a medication covered last month. So, you know, sometimes you have to get a little creative. But there are, I guess one of the takeaways, or a big takeaway, is don't be discouraged that there are ways to get creative. There are people to help you with this. And the answer is not always going to be absolutely 100% we'll get this covered. Here's $10,000. I wish I could do that. But there's help out there. Yes, we. Well, yeah.
So if there is a medication that is too expensive, so where do you come in? Are you right in their office? Do you have someone have to be referred to you? Or how does that work? Like if someone needed your help to get a medication, what would they do? I mean, if they're a patient at VCU.
That's yeah. If you're a patient at VCU, all of the providers know me. I hang out. I kind of lurk everywhere. I'm mainly at the short pump office. I'll get a text message or something like, hey, I really need this help. Can you come in and talk to my patient? I'll pop in, give my patient the phone number, or the providers will give the patients my phone number, they'll call, or, you know, Dr. Cloud will send me an email and say, this patient really needs this, this is why, can you help with that? But most people just, I don't want to say everyone knows me because I don't want to sound full of myself, but for the most part, the providers know me, and a lot of patients have worked with me before in the past. And so I'll get, hey, Amy, can you help out with this? And I also have my business card that has my cell phone number on it and my email address. I don't normally, I don't have a desk phone because I'm rarely at my desk. So I do have my cell phone. Email is usually the best way. Even if it's, hey, Amy, could you give me a call sometime today so we can touch base? And I'll give you a call back, but that's how you get on it. Yes, me.
I have two questions. First is Mark Cuban Cost Plus, is that income related?
Is that, I'm sorry?
Income related.
Income related? No, that is a beautiful thing. Sorry, I should put that on that slide. No, it is not income based. Everybody gets that same price if you go through Mark Cuban.
My second question, I am newly diagnosed with not on medicine.
Okay.
But I'm listening to these thousands of dollars.
I didn't mean to scare you, I'm sorry.
I said I'm newly diagnosed and I'm not on medication.
Yes, ma'am.
But I'm hearing thousands of dollars for medication. Is that pretty standard?
No, ma'am. No, ma'am. Sorry, I did not mean to scare you. Some of the newer meds, I mean, just like with any other condition, some of the newer meds are more expensive. But no, the gold standard medication for Parkinson's is levodopa. And I think the highest price I've seen for levodopa, $20 for a month, maybe. Super inexpensive. Now, obviously, you get to some of these controlled release formulations, and sometimes they'll put fancy packaging on it. But the core group of Parkinson's medications and the medications that you normally start out with, I don't know your health history, but normally people start with kind of these drugs and then kind of we make changes along the way. But no, thousands of dollars is not the standard by any means.
Thank you.
Sorry about that. I should put that out there. Anything else? Yes, ma'am.
Why does every pharmacy charge something different? How can Mark even do it besides he's a shark? How does that happen? What is the problem?
The question,
Oh, that is a big question, isn't it?
repeat the question, please.
She was saying, why do different pharmacies charge, like, why are the prices so different? What is the problem? If I could answer that question efficiently and effectively, I think, I'd be very, very well off. I have my thoughts. I mean, a lot of it does come down to corporations. I think Mark Cuban had means, but one of his wishes was to funnel some of that into affordable medication for patients. And whereas I think, CVS and Walgreens and I don't, we could talk all day about big companies. It is a business. It is a business. So that's what it comes down to. I mean, I wish I had a better answer for you. I don't want to point and make anyone out to be the villain, but it is a business. And like with the GoodRx though, I will see a price CVS for $10 and Rite Aid for $400, and then I'll look up another med and it is completely switched. So it's not that CVS charges more all of the time. It depends on the drug manufacturer and who orders what from what manufacturer. So I will say though, being flexible with, if I call you and say, hey, how attached are you to CVS on Patterson? How would you feel about going to Walgreens at 3 Shots? Like, I know everyone, my dad loves his pharmacist, he brings him flowers and things like that, he's very attached to him. But there are a couple of meds that he goes to a different pharmacy because it's less expensive. Yes, ma'am.
Yeah, we get our prescriptions from Walmart,
Mhm.
and when I mentioned to them that Publix offered the same thing for a lesser price, they said they would leave the price.
Really?
That's good. I mean, it wasn't hundreds of dollars.
But still. Okay, and Walmart matched it. Did they need a coupon or anything, or they just?
No, and they continue to match it too.
Oh, wow. Did everybody hear that? Okay, good.
Sometimes it's from match.
That's good to know, thank you. Anybody wants, any questions? I'm gonna leave my business cards up at the desk back there with Bonnie. If something comes up or you think about something, even if I don't have a great answer for you, like I said, even if I don't have, yes, I can get this